Finally, I wanted to share with you an absolutely astonishing experiment. I heard about this first on NPR last week and asked Troy to track it down. This is from the ChicagoPolicyReview.org, CBSNews.com, and NBER.org, all of these. Social Security had this weird anomaly where for a 2-year period in the late 70s, people got about $1,900 a year more than people got on Social Security before then or after then. It was like this 2-year period when everybody got $1,900 more. So here we are. Now, this is back in the late 70s. So here we are, 80s, 90s. Here we are almost 40 years later. And the scientists said, let's look at those people who got more Social Security money. A lot of them are dead now because they were on Social Security. Some of them are still alive. But we can look at their lifespan. We can look at their quality of life. Their records are still available. Let's look at that 2 years. And what they found was that the people who made the $1,900 a year extra had radically lower levels of dementia. Now, why would that be? Nobody knows, right? I can offer some ideas. Number one, they probably ate a better diet. They had $1,900 extra during the year, so they had an extra $100 or so, $200 a month, so they could buy high-quality food instead of processed crap food that was filled with high fructose corn syrup and stuff. And we know now that, one of the beliefs is that Alzheimer's and some forms of dementia are actually diabetes type 4. So they ate a better diet, perhaps. Or they had better access to health care. They could afford to pay the premiums, the co-pays and the deductibles, so they went to see the doctor more often. Or they used the money to go on vacation or take, have exercise or buy a bicycle. I mean, we don't know. But that little $1,900 extra resulted, let me just read this. This is from the Chicago Policy Review. Along these dimensions, they did find clinically relevant disparities in cognition between individuals who received extra income due to the Social Security notch and those who didn't. They estimate that an extra annual $1,000 resulted in a 1.9-point reduction in the likelihood of being classified as demented or otherwise similar birth cohorts. These results suggest that increased income can prevent a decline in cognition and thinking during old age. The authors find that increased Social Security income has a larger positive impact on working memory and mental status among individuals with low education attainment. That same group also shows a larger drop in the rate of dementia than individuals with higher educational attainment, which may have to do with, higher educational attainment probably means they have a more supportive and wealthier family structure, which is how they got to college in the first place. Over at CBS News, our study suggests that there is a causal relationship. It could still be the case that higher Social Security benefits lead to better access to care. Considering the cost of caring for Americans with Alzheimer's and other cognitive problems, the research has far-reaching implications, CBS News writes. If Social Security benefits are reduced for the next generations due to the current financial stresses on the program, could it hurt their cognitive abilities as they age and lead to huge burdens on Americans' healthcare systems, for example? We do find that higher benefits are associated with better cognition. This is from the actual study itself. You can find this at nber.org/papers/w21484.pdf. We find robust evidence that higher Social Security income improves multiple dimensions of cognitive function among the elderly. Specifically, a $1,000 permanent increase in annual Social Security income leads to a 2.2% improvement in working memory, a 1.1% improvement in knowledge, language, and orientation, and a 1.4% improvement in overall cognition, thought processes. Further, these changes represent clinically meaningful improvements in cognition function. A $1,000 permanent increase in Social Security leads to a 1.9% point reduction in the likelihood of being classified as demented. This is amazing. Just an extra $1,000 a year, which is what these people got for 2 years. The people before them, the 2 years before them, and the 2 years after them, higher rates of dementia, but for those 2 years, lower rates of dementia. And it was just $1,000 in Social Security. And you've got now progressives saying we don't need to just fix Social Security. We need to strengthen Social Security. We need to expand Social Security benefits so that people retiring on Social Security are not living on the edge, so that they have a decent living. You know, undo Reagan's income tax on Social Security, for example. That would increase Social Security benefits. Slightly strengthen Social Security benefits. This could easily be done by simply removing the cap. I mean, this is how, with a large population, we're talking about millions of people that were studied here across all ages, all genders, all racial groups. There's no specific variable other than an extra $1,000 a year. And you get an almost 2% increase in mental acuity, in cognition.
You're listening to the Thom Hartmann program. Call 202-808-9925.
Think that this would be national headline, right? A major mental health and national health crisis averted.